media that they are in active negotiations. Has anyone else on our bargaining committee got an email about that active negotiation? No! Lisa, did you get it? No! Jen, did you get it? Kathy, Janine, Matt, have you gotten that email inviting us back to the table? No! We're available. We're right here, ready to negotiate, and Kaiser isn't showing up to these discussions. I was on KQAD for a full hour this morning. Kaiser was invited earlier this week, and they did not show up. Kaiser was invited to a state Senate hearing last week with Senator Wiener and all of our allies in California government to ask them how SB 221 implementation was going. What do you think Kaiser said? Kaiser didn't show up again. So we're here to demand that you start showing up and have a real conversation. The same problems we've been citing 10 years ago are here, and they're worse, and it won't get better until top executives decide that the work that you all do and our community's mental health matters. So we've got some speakers to speak on that. I just want to honor that we're on a lonely land and that labor struggles are intersecting struggles with racial justice struggles, with disability rights struggles, with documentation struggles. Any system of oppression that's designed to hurt workers is designed to hurt all marginalized groups even more. And those are our members, those are your therapists, and sending a message that you will not settle a contract with the mental health workers that have been in the trenches is a slap in the face. So I want to introduce our first speaker, Laura Bramble. She is a patient. She wrote a very compelling letter in response to Dr. Samir Asser's pre-recorded, what do we call it? Live session on KQED earlier this week, saying that we are the ones that are hurting our patients by going on strike. So Laura is here to speak on that behalf and to let us know why she's here. Laura, where are you? Good morning. You got to speak right into it. Good morning. Thank you for coming.
Does this work? Okay, here we go. My name is Laura Bramble. I am here today to talk about what it feels like to have mental health care needs first and how I feel as a Kaiser patient with mental health care needs this past week. This is an open letter to Dr. Samir Asware and the Kaiser management team about what it's been like for me this past week. Last Thursday, 4 days before this work stoppage began, my appointment for the following Monday was canceled. No options for other care were offered. I was just canceled. This did nothing for my anxiety, subsequent depression, and general worry about what would happen next and when. I was invited to be interviewed by the press multiple times earlier this week to give my perspective as a patient, and so I went for it. I have taken up the mantle of mental health care advocacy by bearing my own soul, choosing to put a face on mental health care at Kaiser. The question...
Good job.
The questions were pointed and my answers were honest and authentic. Dr. Azware, your response to this action was pre-taped and lacked both depth and compassion for anybody. Your outrage is noted. Let me now share my outrage with you. Kaiser's systematic response of allowing these negotiations to continue without apparently any genuine interest in following through on prior promises or commitments or following the law is, from my patient point of view, anxiety-provoking, appalling, and scary.
You're right.
Canceling appointments days ahead of time demonstrates your corporate willingness to continue to deny care to patients. Patients like me, who are already fortunate enough to be in the system and need uninterrupted care. Patients who are not yet under the care of a therapist who need to start treatment, they have already waited too damn long to begin. Dr. Azware, mental health is health. That Kaiser continues to separate the two is appalling. Dr. Azware, Kaiser, you are underestimating the power of patients receiving mental health care services. If we joined our providers on these strike lines, you would see the groundswell of support these truly exceptional professionals have, and a media soundbite would not begin to address our collective outrage as patients. You also need to know that patients receiving mental health care services are not stupid. We see what Kaiser management is doing. We feel your apathy towards us and the disrespect you send our way by marginalizing our treatment needs, making us feel even more invisible than we already are. Mental health care patients already feel the stigma of their troubles. To have a nationally ranked provider such as Kaiser knowingly, willingly disregard us only further discourages patients from seeking help. A canceled appointment compounds that issue. If Kaiser doesn't care, why should I? These professionals worry about us in ways that primary care providers that you, Dr. Azware, don't have to. About whether we'll take our meds, eat, shower, get out of bed, make it to work. Whether the teenager being bullied can get to school. Whether the family dealing with a troubled school-age child can work. Whether their patients, whether your patients can survive while waiting 6, 8, 12 weeks until the next appointment is available. And that's if the patient chooses to come back. As a champion of ethics, Dr. Azware, I read your My Doctor profile. How is this so difficult for you to comprehend? This is the way successful healing therapy works. As a patient, I am baffled. How do you not get it? Dr. Azware, this is the bravest, hardest thing I have ever done. Putting my mental health status on display for the world to see. Respect my efforts and the earth-shattering anxiety I am experiencing, not knowing when I will have a therapy appointment again, while turning my most private life inside out, because I so devoutly believe in the value and importance of uninterrupted mental health care. Dr. Ezwari, I challenge you to meet with me. I invite appropriate union reps and members of the media to join us. Let's have an authentic conversation about patient healthcare needs. Kaiser markets its integrated healthcare model, so integrate mental health care needs with the rest of Kaiser. Stop breaking the law. Give mental health the priority demanded by the law. I want this strike to end because, for myself and on behalf of all Kaiser mental health care patients, we need this strike to end. We are hurting, we are waiting, we are suffering. Put patients over profits. Put patients over profits. Please.
I want to introduce our next speaker. Marie Gonzalez Tellez works for our transgender clinic, uses they, them pronouns. Please give it up for Marie.
Hi everyone. My name is Madi. My pronouns are they, them. I'm a proud first generation child of immigrants. I'm bicultural, bilingual, queer, and non-binary. I'm one of few queer trans clinicians of color across the Northern California region. I can count us on one finger. And I'm also a gender therapist at our multi-specialty transitions clinic. On Monday, July 25th, our clinic received its first threatening voicemail, calling any clinician involved in pediatric care malicious, ill-intentioned, predatory individuals mutilating children. As we received more of these voicemails, it became clear that this would not be the end. At this moment in time, there are over 25 anti-trans pieces of legislation circulating our country. At this moment in time, there are over 270 anti-LGBTQIA pieces of legislation circulating our country. As NUHW members, us gender therapists want you to know that we strike not only for patient care, but for our patients' right to exist. For our right to exist. Kaiser has refused to issue a public statement regarding the matter, citing their desire for it not to frighten the public. And yet, the so-called anti-trans activist who incited these voicemails spoke openly last night against gender-affirming care on Fox News. Kaiser's failure to move past a message of thoughts and prayers speaks to a larger systemic problem that we have seen time and time again. Let us not forget how Kaiser was silent and failed to support Black clinicians following the George Floyd and Breonna Taylor protests in 2020. Let us not forget how they failed to support AAPI clinicians following anti-Asian attacks and violence in 2021. Queer trans clinicians of color are leaving in droves. As we fight for our patients, we see ourselves, our lived experiences, their lived experiences. As we see the system fail them, we see the system continue to fail us time and time again. We are tired. We are tired of the many thoughts and very little action. Trans lives matter. Black lives matter. lucha y nunca, nunca nos podrán dividir. Your struggle is my struggle, our struggle, and they will never, ever divide us.
Right, we've got another one of our clinicians that are going to come up and tell you what's been going on in Santa Rosa. Give it up for Natalie Rogers. She works for the Santa Rosa emergency team.
All right, let's see if I even have a voice left after all that chanting we were doing. Thank you guys so much for being here. Thank you for having me before you. I didn't really know why I was asked to speak, so I will just tell my story. I am a clinician of color in Santa Rosa. I am a survivor from my sister killed herself 1 month before my 16th birthday, and she died at Kaiser, Santa Rosa. Excuse me, Kaiser Vallejo. There we go. I am a mother of a currently transitioning, now my daughter, which I'm very proud to say. And I am the mother of a young woman who is finding herself, and I am okay with that. But I'm also a mother for 8 children, some of which need therapy that cannot get therapy because they are Kaiser members. They cannot get therapy in a timely manner. And some that have the means will go and pay for outside care. Everyone does not have the means to do that. So this becomes an equity issue, Kaiser! There is no way that you should have medical insurance or not have medical insurance and not be able to get the care that we all deserve. I am here for our patients. When you guys can't see them, they come to the ED. I am here with my heart broken because I've seen shirts that say Kaiser no more suicide, but I say Kaiser no more suicide attempts. We don't need our patients to die for us to be outraged. We need to provide the care before they try to take their lives. Every night I work in the ED, I wonder when the gurney's gonna come in that has one of my family members on it because they were denied care. That is not a good thing.
Okay.
So, I'm happy to see all of you here again. I'm happy to see you here because my private practice was offered $10,000 for 2 months, 5 patients a day, for 8 weeks to provide care because we are standing here. So I have a question for you, and my question is, are you ready to fight? Are you ready to fight?
So we have a clinician from Children's Hospital that's going to speak next. Please give a warm welcome to Jackie Shallett.
Thank you. I'm from Children's Hospital Oakland, a therapist. I'm also a proud NUHW member. And I came here to tell you that I'm inspired by your fight, because this fight helps my patients, it helps patients around the state, and it helps patients around the country. Yes. Thank you so much for standing up for mental health care. Keep it up.
All right, without further ado, I just want to welcome our president of the National Union of Health Workers. Please give it up for Sal Roselli.
I could not possibly be more proud
to be a leader of this union with all of you. This is the 12th year of our struggle with Kaiser, 12 years. How many of you were here 12 years ago when 4,000 clinicians joined NUHW? Let me see your hands. 12 years ago, when clinicians joined the union, it was the first time our union had experience with behavioral health care. Lots of experience on the medical side. And we quickly learned the huge problems about access to care that existed within Kaiser. And we did a white paper. We interviewed hundreds of clinicians and produced a white paper called Care Delayed, Care Denied. Some of you remember that and contribute to that, right? And we, in a very constructive way, went to the president of Kaiser at that time and said, we want to work with you to fix the problems. We want to collaborate with you, much like we did on the medical side, to make Kaiser the best place to receive behavioral health care and the best place to give mental health care. That offer was rejected. And we began to expose the problems with Kaiser and release that paper to the press. And Kaiser's reaction was, you know what? We're never going to give NUHW a contract because you went public, because you're standing up to us. That really happened. So it took 5 years of strikes and actions to finally win the first-time contract with Kaiser. And 5 years into it, how many of you were here in 2015 when we finally settled that contract? We settled that contract the night before an open-ended strike was about to happen. And while the emphasis was on access to care, at that time, Kaiser was also demanding that you all lose your defined benefit pension. So they're telling the press, you know, we're having a hard time hiring clinicians, but they're going to take away your one defined benefit pension. And by the way, as an aside, there are 30 Kaiser executives that have 8 retirement plans each. At that time, the current CEO of Kaiser, Greg Adams, some of you know Greg Adams, right? He was the president of Kaiser in Northern California at that time. And he came to us after we issued that 10-day notice for an open-ended strike and asked us to come to a table. And I'm now remembering Clem Papazian. Boy, do we miss Clem Papazian. And again, the night before that strike was supposed to happen, we settled. They dropped their takeaway for the pension, and your committee accepted a tentative agreement, and that strike was avoided. And I remember late that night, Greg Adams saying to us, after we did that TA, this can never, ever happen again. Yeah. How many folks were here in 2018? 3 years later, okay? In 2018, went through the same struggle, same issues. It wasn't about economics. It was about access to care. And we decided again, you decided again, to issue a 10-day notice for an open-ended strike to win on those issues. You know, when a union is required to send a 10-day notice by California and federal law to give the provider, to give Kaiser, at least 10 days to come up with the plan for the continuity of care once the strike happens. And I remember we had the President Pro Tem of the Senate, Tony Atkins, and Assembly Speaker Anthony Rendon sent a letter to the CEO saying, this is the law, where's your plan, Kaiser? Kaiser ignored the letter and canceled, in one day, they canceled over 100,000 appointments throughout Northern California. That was their plan, just canceling patients. And I remember your committee being tortured, you know, by what was happening and had a very hard time deciding to call off that strike because the only people that would have been hurt are those 100,000 patients and all of you, all of the clinicians, while Kaiser would continue to collect premiums without providing any care. Department of Managed Healthcare back then did nothing. They did nothing to force a settlement. But I'll tell you, that struggle, those years of struggle, so deeply educated elected leaders in the state, members of the Senate, members of the Assembly, about Kaiser and about the problems for behavioral health care, that since then, in the last 2 years, we've helped pass 2 very important mental health parity laws. The first is SB 855, right? Which expands the behavioral health care issues that must be provided, and it states that if a provider, if Kaiser cannot provide this full range of care, they have to find a clinician outside of network. They have to make an appointment with a clinician outside of network, and Kaiser has to pay for it. The problem is they don't do it. They're breaking that law. That's why we're here, right? And we helped pass SB 221, right? Which states that emergency care has to be provided in 48 hours, and other therapy, non-emergency therapy, within 10 business days, unless the clinician deems it's not necessary. Does Kaiser do that? No! You know, I remember when these laws were signed by Governor Newsom, he invited us to come to the ceremony, the signing ceremony, and he credited NUHW, and I remember him saying, there's a lot of folks out there that are unhappy about me signing these laws. He's talking about the hospital industry, right? And Blue Cross and Blue Shield and Kaiser Permanente did amazing, heavy lobbying to get him to veto those bills. I remember him crediting NUHW and also saying, and you know what? This is a step, not the end game, to achieve parity for mental health care. That's right! So now, it's up to the government to enforce these laws. You know, before this strike happened, we did so many multiple complaints with DMHC that got unresolved. Since it started, daily new complaints from evidence that you have helped get. People from the inside are calling us. You know, one example, Kaiser's saying that a lot of clinicians are crossing the line, right? Well, Kaiser, if a lot of clinicians are crossing the line, how come you're forcing receptionists who have no training to call patients to cancel their appointment? So now it's up to the 3 branches of government, right, to enforce these laws. That's next step. We want that to happen ASAP, so this strike ends and we can go back to work. The 3 branches of government, the Assembly, Anthony Rendon, leadership there, totally with us. In fact, SB 221 in the Assembly passed unanimously. Right? Republican leaders co-sponsored it in the Assembly. The state Senate, Senate Pro Tem President Toni Atkins, absolutely with us. You've seen the statement she's put out. She also helped Senator Weiner schedule a hearing 2 weeks ago on mental health care where DMHC came and said all the right things. They said, Kaiser, be on notice. Even if there's a strike, you have to obey these laws. Are they obeying the laws? No! And then the branch of government that's most powerful in this situation, is the governor's administration, right?
What about the
and just
Attorney
yesterday,
General?
I hope you saw the statement from Lieutenant Governor Eleni, just in total support, right? In total support, Eleni Goulakis, for what we're doing. So now we need Governor Gavin Newsom, to walk the great talk and follow up on his commitment to achieve universal health care here in California, which must include mental health care. So folks, I'm so proud of all the work that we did to help pass these laws. And we were in coalition with scores of other organizations and community groups to help us accomplish that. But there's only one senator, right, who authored these laws. And that is Senator Scott Wiener. You got it. We have a saying in our union when it comes to politics and politicians. And that saying is, when it comes to elected leaders, we don't have any permanent friends. We don't have any permanent enemies. We have permanent issues. Well, let me tell you, when it comes to rules like that, there's always an exception. And Scott Wiener is our friend all the time, right? He is our permanent friend. Please welcome Scott Leader.
Thank you. Can we hear it for Sal Roselli? You know, I've been around politics for a long time, and I have watched Sal for a very, very long time, and there is no harder fighter than Sal Roselli. He will never, ever give up. So Sal, thank you for everything you do. You know, and I want to thank you. First of all, thank you for saving lives and being there for our community day in and day out. But thank you also because you're on strike, and of course it's about the contract, but you're not just on strike about the contract. You are striking because you care like hell about the people that you serve and their health. And there are plenty of strikes that are about increasing pay and health care and benefits and all that, and that's really important. But you're not just demanding that. You are demanding that your patients be treated better. And I thank you for that. You know, I am so sick of behavioral health being treated as something in the back seat, an afterthought. For so many years, for decades, for forever, it's been like mental health is just like, just suck it up, just be stronger, just get over it, just be tough. As if it were just like some sort of personal failing. And we know that, I mean, there's not even a debate. Mental health is no different than physical health. It is the same. And we would never, if someone showed up and said, I have a broken arm, would we ever let them say, oh, come back and we'll give you an appointment in 3 months for that? Would we ever let them say, oh, you have a broken arm, come back when it's infected, it's not bad enough yet? We would never let that happen, and yet that is exactly what we've been letting happen with behavioral health here at Kaiser and in this country, and it has to stop. It has to stop. You know, Sal talked about these bills that we all worked on together, our mental health parity law, SB 855, the timely access law, SB 221, and those were big fights. The vote tallies in the end were off the chart, bipartisan, overwhelming support, because when you put it up for a vote at the end, members of the legislature, bipartisan, get it. But they were both huge fights with Kaiser and with the other health plans to get there. But together, in coalition, we got it done. And I am so proud of that coalition. And NUHW played such a huge role in getting both of those bills done. But now we have to enforce them. And I've learned over time, it's wonderful as a legislator when you're authoring a law and you see those votes go up with the tally and the governor signs it, it's like exhilarating to pass a big law. It makes you feel so good. But I've learned over time it's just step one. Because if you don't pay attention to the enforcement and implementation afterwards, it's just a pretty piece of paper with the governor's signature on it. And I like pretty pieces of paper with the governor's signature, but it's not enough. And so we are holding the health plans accountable, and we're holding our agencies accountable to enforce this law and make sure it has meaning for people's lives and people get the health care they need and that they can survive and thrive, because that's what it's about in the end. It is frustrating to me, and I know to all of you, you know, in SB 221, it's a pretty basic thing. It's just saying if someone needs an appointment within 2 weeks, you got to give them an appointment within 2 weeks. We even gave them an extra 6 months to comply. It should have gone into effect January 1st. We gave it till July 1st to say, let's give them some extra space to comply. Kaiser is not complying with SB 221. And it's It's time to come into compliance. It's time to make sure people have access to care. That's what this strike is about, and I am here with you in complete and utter solidarity. So let's keep fighting. Thank you.